Hi guys, a short video about ethical cases. Now, ethical cases are designed to be challenging. They do make us think, they make us work a little bit, and there's a lot of information coming in often from lots of different sources, and we've got to all compute that into our mind, which is already running 100 miles an hour. So ethical cases are very, very difficult sometimes, but there's a few core things that I think can make your life a lot easier when these types of cases come about. I'm a GP and a medical educator, and hopefully this video will give you some value. Let's get started. Now, firstly, just like in any other CSA case, understanding the core issues of the case are so important. That's no different with an ethical case. Now, in an ethical case, there's going to be different issues to what you're probably thinking about. So, things like your competence, things like confidentiality, things like the right to be involved in decision making, things like the right to full knowledge as a patient. Now, these are a lot of ethical principles that we often understand as a doctor, but we very rarely talk about them. And we're not used to sometimes explaining these things and discussing them in details. That's something that has to be understood. But before you can discuss it and debate it, you've got to understand the core issue of a case. Now, we all know about our key 4 medical ethical principles, don't we? Beneficence, non-maleficence, autonomy, and justice. So you've got to understand these 4 things really well so that you can start to work out what those other side kind of sort of issues are when a case comes up in terms of medical ethics. Now, how can you work out whether this is a case that is testing ethical principles? A little bit goes down to sometimes what sort of questions the patient asks of you. So for example, doctor, is this right or wrong? Doctor, am I allowed to do this? Doctor, was that other doctor right in doing this? Doctor, is this the right way of thinking about things? When those sorts of questions come, then you start to think, right, this is a maybe an ethical sort of case here. There's a few debates that need to happen. There's perhaps no right or wrong. But going back to your 4 key core ethical principles are really important, and understanding those before you go into the CSA is really key to doing well in an ethical case. And also, when you're looking at issues of a case, make sure you're very clear on what is an ethical issue and what is a legal issue. Now, there are differences between legalities and what you can do from an ethics point of view. So one is very clear cut, yes or no, what's right or wrong, what's possible or not, whereas in actual legalities type stuff, whereas in your ethical stuff, it's a bit more debated. There's often no right or wrong answer. It's often sometimes one person will see it a different way to another. So understanding the core issues in the case, listening to the questions that are coming, understanding the key 4 principles of ethics that you know yourself, and working out what's a legal issue and what's an ethical issue are really important in understanding ethical cases early so that you can debate it correctly and adequately in the second half. Okay, secondly, remember, you don't have to always make a decision or give an answer to someone right here, right now. Often we think we're pressed into making these really difficult decisions, but often a lot of debate, a lot of thinking, a lot of sort of reflection sometimes before you come up with an adequate plan. So don't feel that you have to give an answer right here, right now. And don't also feel that you have to come up with the answer yourself. We are, as GPs, have access to lots of different people, lots of people that can perhaps help us in certain situations. So you have other colleagues that you could talk to, you have your medical defense unions that you can talk to, you have specialists in hospitals if they're not your own GP colleagues, you have people within social care, social services, health visitors. There's so many things that you can think about before you have to make that right decision right here, right now. Now, often we feel 10-minute pressure, patients come in with a question, we need to know what to do right here, right now. But often, like we said in the first tip, it's about understanding the issues and working those through, not necessarily what exact answer do you get. Now, obviously, there are going to be some cases where they have to push for an answer because things are quite pressing, it's quite time dependent, and obviously you've got to make a call in those cases. But a lot of ethical issues are not going to unravel in the space of 3 minutes. They're going to unravel over the space of 3 weeks, 3 months sometimes. And often just gathering all the data, understand the issues, having a debate about the possibilities, and then maybe coming up with a plan that allows you to look into it further, get some advice, is often a perfectly adequate way to go. Don't feel the pressure to give an answer right here, right now, if it is not needed. Now, one of the most difficult things often that we find in ethical cases is trying to convince the patient or show them why the ethical principle is sometimes so important for us as a doctor. That can be quite difficult to do. And what do we try and do? We try and explain the principle behind the ethics sometimes. So we'll talk about the principle of confidentiality. We'll try and explain the principle of capacity or competence or autonomy. Now, we understand the principle. So when we explain it, it makes sense to us. We we can relate it to that situation. Now, a third party, like a patient or someone else or a relative or a carer, may not understand that principle, and even if they understand the principle when you explain it, there's still a lot of personal feeling going on there, so that they may understand it, but it may not be enough to convince them of the reason why something might not be able to be done or might have to be done, for example. So one thing that we found very useful is try and flip the ethics back on the other person. Flip the situation back on them and make it personal to them so they understand the situation a little bit better. So for example, with confidentiality, say if someone comes in and asks for information about their brother's notes, for example, rather than explain the principle of confidentiality, flip it. Look, imagine if your brother came in and asked us for information about your medical records. Now, in the same way that I wouldn't be able to give information to them without your consent, unfortunately, I can't really give any information about your brother to you right now unless you've gone through the proper process of consent. Now, straight away, that brother will understand that implication because it's personal to them. You've flipped it, you've made it more realistic for their point of view. Say, for example, as a doctor, you're being pushed into making an ethical decision. Now, rather than trying to explain the principle of ethics or explain the principles that are going through your mind, flip the situation. Now imagine, Mr. X, if you came in and went to see another doctor, for example, or your brother went to see another doctor, and they wanted to get these answers out of their doctor right here, right now. Just how you can imagine that doctor wouldn't be able to give an answer that is probably not looking at all of the key aspects, not getting enough information, not discussing with the right people. The last thing you'd want, I'm sure, for your brother is that the doctor gives them an answer without all the information and looked at properly. Now, in the same way, I wouldn't want to do you a disservice by giving you an answer right now when the situation clearly has a lot more things to talk about and a lot more people to get involved. So again, flip the situation, make them understand from a different point of view that's a bit more personal to them, and often they may come out the other side. Again, say for example, you get a carer coming in who wants a particular investigation being done for their mother or for their father, for example. Rather than trying to explain the principle of capacity or autonomy or right to be involved in decisions, flip it on the other person. Imagine if your son or daughter came in and asked us to do a test on you without you being involved. Now, just in the same way that you'd really want to know about that discussion and get involved with it before we make a decision on your behalf, the same applies for your mother. I can't really go and make a decision on their behalf without talking to them at the same time. Again, you flipped it on them, make it personal, very hard for them to fight back, because if you just explain the principle of these things from a medical ethics point of view, you're going to get the same questions coming back again and again, because it may not hit them as hard as it does when you make it personal. So think about flipping ethical cases, making things personal, turning it around on the other person, and you'll find that it does the job quite well for you. Now guys, from your practice that ethical cases come in all sorts of shapes and sizes, all sorts of depths, all sorts of different angles, and you can never feel fully prepared for ethical situations because they're all slightly unique and slightly different. But understanding your core 4 principles and also the little ethical things that go in and around them can make a big difference to the confidence that you have when you're dealing with such situations in the CSA. Now, we know ethics jobs. In our course, for example, we run lots of ethical scenarios because we know that people struggle with this stuff. You don't often get it in real life, you don't often get it in your practice, in your study groups. We cover a lot of that stuff. But if you're practicing cases with study groups, make sure you get some ethical principles in there, and make sure you push the other person a little bit in terms of the ethics, so they really have to think and work on their feet, because often we're not used to doing that, like we said. Now, I hope that's something of value for you. There's lots of other videos to have a look at in terms of CSA and all other aspects of GP training on the channel. Subscribe if you find it useful. If you have any other queries for any other videos that you want making for CSA, but for anything to do with GP training, just drop me a line, a tweet, a WhatsApp. All our details are down below. Hopefully we'll get to meet some of you guys in the near future. If you are taking the exam in the next few months, once again, good luck. I'm sure it'll be absolutely fine. Take care, and we'll catch up soon.